This segment of Delmarva Life is brought to you by Peninsula Home Care.
So before the break, we talked a lot about your health. Nobody wants to get sick, but it's life. It happens.
Well, of course, and some illnesses are more serious than others and can land a patient in the hospital. But once that patient has been treated and is headed home, that usually is where they want to stay and not back in the hospital. Joining us today to tell us more about how to do that is Nancy Bagwell, Area Director of Operations with Peninsula Home Care. Thank you so much for joining us this afternoon.
Thank you for having me.
So we're talking about keeping people out of the hospital. Why is it important to keep readmissions low?
Well, it's important because it shows that we are taking better care of our patients, more positive outcomes. It also shows an increase in compliance on their behalf and some accountability.
So is a big part of avoiding readmission, is prevention a big part of that?
It is. Part of that is, you know, in our local counties in Wacomico, Worcester, and Somerset, we have people who are 65 plus and expect to age double that.
Wow.
In 10 to 20 years. So prevention is a big part about learning signs and symptoms, what you do with those signs and symptoms when you need to see your physician, and how you keep yourself healthy.
And you have some interesting numbers as far as readmissions go for Peninsula Home Care.
Well, actually, Peninsula Home Care is published in November of 15 at 7.8%, and our national average is about 12%. Our state is a little higher than that, probably about 12.5%.
Do you work closely with the hospital on this?
We do work closely with the hospital, and what's important about that is making sure along the continuum of care that we all understand the disease process, but also what happens beyond that disease process. Are there other comorbidities? What happens with discharge planning? Are we able to access electronic medical records so that everybody knows who's taking care of that person?
And patients play a big part of that as well.
They do. They must be able to accurately talk about their medications, how and when they take them, what their other lifestyle situations may be that might take them back to the hospital, such as social issues, they can't afford their medication.
So I guess with a lot of things, communications is pretty important in all this.
Communication is key, and actually Peninsula Home Care has interdisciplinary team meetings so that we can actually case manage that across the continuum, meaning that physical therapists, nurses, social workers all come together to talk about that patient once a week.
And of course the hospital, Peninsula Regional Medical Center?
Absolutely, and we share electronic health records so that we can begin preparing for those patients upon discharge, and then we can share that information with their primary care physician, their specialist, and each person can be on the same page for the total health of the person, not just the one disease process.
So do you kind of act like the middleman between the patient and the...
We actually are. It's interesting because when we go into the home, we're able to see things that are not seen when people are in the hospital or in the physician's office. So we can share that with people at the hospital when they are readmitted, and also with their primary care physicians, things that may keep them from being compliant.
And you can put it in the right terms for each one.
Oh, absolutely. We can tell about signs and symptoms, where they go, what their diet is.
Right.
All right.
Nancy,
Very
thank you
good.
so much.
Thank you.
Wonderful talking to you.
And to read more from Peninsula Home Care, go to WBOC.com. Click on our picture at the top of the page.